Hello, I'm going to talk about gastroesophageal reflux, also known as GERD. GERD is an abnormal amount of reflux up through the lower sphincter and into the esophagus. Basically, is when the stomach contents move backward into the esophagus, and because the stomach makes acid to help a person digest food, gastroesophageal reflux is also known as acid reflux or heartburn. And almost everyone has this type of reflux at some time, and they are not even aware that is happening. What are some causes of GERDs? So basically, the lower esophageal sphincter, which I will call LES, works in the main reason why people have gastroesophageal reflux. The LES is a muscular ring that at the bottom of the esophagus where it joins the stomach. So as a person swallows food, drinks, the muscle in the esophagus moves the food down into the stomach. Also, the LES relaxes just enough to allow food and liquids into the stomach, but then the powerful muscles in the LES contract, so they become so tightened to stop food and liquids from moving back up to the esophagus. In other words, the job of the LES is to prevent reflux. However, sometimes the LES might not be able to do its job for various reasons, and for instance, in some people, the LES doesn't tighten properly. In other cases, the LES doesn't close quickly enough or at the right time to allow stomach contents to wash back up. However, if a person has eaten way too much, the stomach may be so stretched full that the LES can do its job properly. Other causes of gastroesophageal reflux include disruption of the anatomical barriers or the anatomy or disruption of the esophageal sphincter, which may include hypotensive lower esophageal sphincter pressure, causing abrupt increase in the abdominal pressure. Also, another cause may include esophageal clearance, in which the GI acid produced spend too much time in contact with the esophageal mucosa, and normally swallowing contributes to esophageal clearance by increasing salivary flow. Another cause is the mucosal resistance, in which the mucus secreted by the mucus secreting gland involves in the protection of the esophagus. Furthermore, a delayed gastric emptying may also be a cause, which is an increase in the gastric volume, and composition in reflux, which if the pH of the reflux is less than 2, esophagites may develop secondary to protein denaturation. The most common symptom of for GERD is heartburning, cessation of burning in the chest. Treatments for a gastroesophageal reflux disease include 24 hours pH monitoring, which helps in establishing the presence of acid above the LES at the cause of symptoms or esophageal damage. Also, you can use antacids, and you can find those over the counter. You can include histamine, H2 receptor antagonist, and also you can use drugs such as cimetidine, sanizatidine, acid ranitidine, and there is dosage that you can use per day. And the goal of those treatments is to alleviate or eliminate the patient's symptoms and promote healing of the injured mucosa and prevent the development of complications.